So hello everyone, my name is Taylor and I've just completed my BA in Health and Community Services with a focus on Indigenous health. As an Indigenous woman coming from the Treaty 6 Atakakuk Cree Nation in Saskatchewan, I share this immense passion for learning about my cultural roots and advocating for equal access to care for Indigenous communities and people. That being said, welcome to my presentation on my practicum with Synthesis Health. I would like to start with a land acknowledgement of Calgary, Alberta, as I have completed my practicum and the final year of schooling in my hometown. So in the spirit of reconciliation, I acknowledge that I live, work, and play on the traditional territories of the Blackfoot Confederacy, the Tsuut'ina, the Eoksay Nakota Nations, the Métis Nation, and all people who make their homes in the Treaty 7 region of Southern Alberta. So as I already mentioned, I completed my practicum with Synthesis Health. Based out of Vancouver, BC, Synthesis Health is a cutting-edge technological solution for teleradiology, medical imaging, and lab clinics. The goal for this organization is to develop technology and attract the greatest talent to offer services that improve patient outcomes and elevate the experience of clinicians. I did complete my practicum remotely, as most of my coworkers also worked remotely. Therefore, I maintained communication through Microsoft Outlook and Teams. But having already completed 2 years of school online, this wasn't much of a learning curve for me, but I was always holding myself accountable and responsible for the work that I completed through time management skills. Specifically for my practicum, I worked alongside their Supercluster 1 project, which is the ultra-portable X-ray solution for remote and Indigenous communities. Synthesis Health partnered with Fujifilm to create these ultra-portable X-ray devices with the overarching goal of creating access to quality care for Indigenous communities and people. As you can see in the slide, on the left picture is the ultra-portable device that is used to take those X-ray images. And at the bottom of the slide, this is an example of how the device works when a technician is taking a chest X-ray. All of the images immediately go into a cloud called SynthOS, which is accessible in an area with Wi-Fi, which can also be accessible even in remote communities. So my role in my practicum was to serve as an internal champion to build and communicate Indigenous perspectives of this project in various forms, such as presentations and reports. So this device solution addresses the gap in access to healthcare services in Indigenous communities, especially in remote communities. And because of their work, it is crucial that their non-Indigenous staff are educated in cultural safety. Throughout my practicum, I had the pleasure of meeting many coworkers within the organization with diverse professional backgrounds, visiting radiology clinics, attending meetings with partners involved in the project, such as the First Nations Health Authority, and visiting my own reserve in Saskatchewan to gain a hands-on experience and insight for feedback, as they have one of their devices in their holistic wellness center. So my biggest task that I completed in my practicum was creating an informational workshop addressing Indigenous cultural safety and humility. I took the information that I learned throughout the past 2 years in school and applied it into a workshop that educated my colleagues on how to be culturally safe and appropriate in the future of their project, working alongside their partners, Indigenous communities, and as an organization as a whole. Within this project, I created a large presentation and an infographic, which was a time-sensitive task as I only had 1 month to put it all together for the big day, which was April 5th. This was a very rewarding project that I completed, as I was honored to lend a helping hand in educating individuals at Synthesis Health and starting the conversation of the important topic of cultural safety and humility. So there are 3 values and knowledge areas that guided me throughout my practicum. The first one is community-based approaches to research and knowledge development. I experienced firsthand community responses for the ultra-portable X-ray solution and reported back to Synthesis Health to improve our approach, our device, and overall communication with Indigenous communities we are providing this solution to. From the experience of visiting my reserve and noting their feedback, I took my notes and presented them to my supervisor, Jeremy Kerr, and other professionals in Synthesis Health to spark a discussion about how to better structure the project and succeed in the future. This task correlated with the knowledge area of social and life determinants of health because I was conscious throughout my practicum of how the social determinants of health impact Indigenous communities and the importance of access to healthcare services and solutions are beneficial for Indigenous peoples and communities in Canada. The second value is interprofessional and multidisciplinary approaches to practice and research. Throughout my practicum, I attended multiple meetings and discussions with Fujifilm and the First Nations Health Authority, working with Synthesis Health, and I saw firsthand how interprofessional collaboration, team functioning, and collaborative leadership were being integrated into the work to create a revolutionary solution for remote and Indigenous communities. Having knowledge from Health 404, which was interprofessional practice, I learned how to work in an interprofessional team and environment to create improved health outcomes. I practiced the knowledge area of effective multidisciplinary teamwork in the integration of interprofessional collaboration, teamwork, conflict resolution, and communication within the work that I completed. The third value is diversity and cultural safety. As I already mentioned, I merged my knowledge about Indigenous cultural safety into a workshop. The knowledge area of improving health and reducing health inequities led to the introduction of the cultural safety and humility workshop and success within the work that I completed in this practicum because I saw an opportunity to educate members of my organization to appropriately aid in the access to healthcare services in Indigenous communities. Call to action number 24 addresses the need for educational courses and training on Indigenous health, culture, and history within medical and nursing schools in Canada that will require skills-based training in intercultural competency, conflict resolution, human rights, and anti-racism. This call to action resonated with me because I think it should be integrated into not only nursing schools and universities, but also into businesses and organizations that have any interactions with Indigenous communities and people to lead their work in a respectful and appropriate way. The first way I can put this call to action into practice is to always be open to having a conversation and addressing the cultural safety and humility within the workplace and in my everyday life. The second way would be offer teachings, presentations, or simply a conversation on Indigenous culture to anyone who is interested. These two actions I dedicate to putting this call to action into practice will allow for a more safe and more respectful environment reflecting on Indigenous culture, communities, and people to better our society and work towards reconciliation between Indigenous and non-Indigenous Canadians. I couldn't be more proud of myself for completing the work that I did at Synthesis Health. My biggest accomplishment was creating the Indigenous Cultural Safety and Humility Workshop because I felt connected to the project on a personal level, and to be able to share that with my colleagues was a huge achievement for myself. My supervisor, Jeremy, and other high-up professionals trusted me during the process of putting together the workshop, trusted that all my information was accurate and authentic, and respected me for the impact it had on not only my colleagues, but on the entire organization. Another highlight of my practicum was being able to work with so many great professionals. I had the opportunity to meet so many great people throughout my practicum that reinforced me that the work I was doing was impactful and important. Having an encouraging and supportive work environment allowed me to have confidence within the work that I completed, which sets the bar high for the career I obtain after graduation. I would firstly like to thank my supervisor, Jeremy Kerr, for not only being my supervisor, but a mentor to me throughout my practicum. His guidance and trust within the work that I completed drove my success within my practicum, and I'm extremely grateful to have met him. To Dr. Deepak Kaura, thank you for not only being a family friend of mine, but someone who offered this practicum position to me in the first place. Being the CMO and CPO of Synthesis Health, Deepak was very involved in the work that I completed and always offered a helping hand for me to achieve the greatest success in his company. Thank you to Synthesis Health and partnering organizations for being so welcoming and supportive throughout my practicum. To my UVic instructors, without your guidance and teachings, I wouldn't be in the position I am graduating from university. Thank you to each and every one of my professors for believing in me and teaching me such amazing things that I will carry with me for the rest of my life. And lastly, to my classmates, all of you have been absolutely amazing in helping me develop into the graduate I am, and I wish you all the best in the future. Here are my references. But that brings me to the end of my presentation. Thank you all for listening about my experience, and I am truly blessed I had such a great opportunity. I'd be happy to take any questions you may have at this time.